We're back with our coverage on how India is prepared to fight COVID. But we'll also have to tell you about the global context. Let's get you a lowdown on the global COVID case count. In Singapore and in several parts of Southeast Asia, COVID cases are rising again. The new variant that we're talking about, the subvariant of Omicron, that is JN.1, which is highly transmissible, but is not associated with severe illness or any hospitalization. The WHO is also monitoring the variant closely. Experts are advising that there should be continued vigilance despite, low fatality rates. Dr. Bagai, we were talking about senior citizens and those with comorbidities. I'll take two questions with you before I go to my reporters. One, should senior citizens take extra precaution? And number two, when it comes to traveling, especially to those countries where there is an uptick in cases like, say, Hong Kong or Singapore, and when one returns, what is the kind of precaution one should take?
Again, so splitting it quickly into two parts. So let's identify which are the vulnerable group as people who are at high risk. So one is the children less than the age group of 5, because the immune system is still not as developed as adults. And the second is the age group of above 65 and mainly above 70, because that's a concept what we call as immuno-aging. That means your immunity goes down. The vulnerable groups in terms of medical illnesses are people who have pre-existing comorbidities. Heart disease, hypertension, diabetes, especially if it is not well controlled, chronic lung disease, COPD, smokers, chronic liver disease, chronic kidney disease, and so on. These are the people who are on immunosuppressant medication. So these are the group of people who are more likely to be susceptible to any illness, vis-a-vis even JN.1. So these are the groups which we need to be more careful in terms of controlling your pre-existing disease, taking your medication regularly, and the thing which will save maximum lives going forward, not only in this small outbreak, but worldwide for any respiratory infection, is a good qualified mask, specifically an N95 mask, which will prevent the inflow or the egress of all viral infections.
So masks can do a lot. And doctor, I was asking you that question about those who have, travel plans to places like Singapore and Hong Kong, those countries where there is a surge in cases currently. What precautions should one take when they go, and number one, when they also return?
Yeah, so the simple precautions are: make sure that your pre-existing illness is well controlled, especially diabetes and hypertension. The second thing is, in a closed environment, that means like an airport or a security lounge area, or during the travel, please wear a mask. This is going to help prevent the infections coming in. This is, we have seen this in worldwide studies, that aircrafts do form a platform for transmission. There is no travel advisory not to travel to these countries. So again, I say that there should be no panic, a simple precaution. The variants which we are seeing in the other countries like Hong Kong, Singapore and other places are not JN.1 specifically. We are seeing what we call as LP8.1 or LF7.2. They are separate variants which are breakaway descendants of JN.1. So these are again not as lethal. They are transmissible. That means person-to-person contact. Keep safe distance of at least 6 to 8 feet. Wash your hands. Keep your oral cavity clean, and wear a mask.
So let's not forget the basics when it comes to taking these precautions. Going to my colleagues Nilesh and Arpita and Imran, who are also with us, because of the paucity of time, I'll have to take a very short question with you. Arpita, Kerala has reported a little over 180 cases in the month of May itself. What are the steps taken by the health department on the ground?
So when we talk about Kerala, they have recorded 182 cases, where Kottayam has registered the most number of cases with 57. So Health Minister Veena George held a meeting last week, and she has advised everyone to use masks in public places like hospitals and other public transports. And she has specifically asked the hospitals to keep RT-PCR test kits ready. And also, any patient with mild symptoms is advised to take COVID test in Kerala.
The mask up advice has been given by the State Health Department. Going across to my colleague Nilesh, who's also with us in Mumbai. What's the preparation on the ground? What are the steps that the state government is taking currently, Nilesh?
Well, yes, quoting our Health Minister, Mr. Prakash Ambedkar, he goes on stating that as of now, no guideline has been received from centre, and which is why the earlier guideline is into place, and the situation is currently not concerning for the Health Department, which is why no fresh guideline has been issued. However, all the hospitals, be it state or private, are completely prepared. Given the point that just yesterday, that is the number of COVID cases has been reported for 45 plus. So these are the fresh number of cases that has been reported here in Maharashtra, of which alone 35 have been reported from the financial capital Mumbai city, which currently remains to be topping the chart when it comes to
in Mumbai itself, there has fresh cases have been reported. Cutting you short there because we have to take a break. I'm going across to my colleague Imran. Imran, quick, a quick update on what's happening in Karnataka.
Well, the Health Department issued general guidelines about this follow safety protocols and norms. And since the numbers are very less, close to around only 35 COVID cases have been reported, out of which 33 in Bangalore. Across Bangalore, the general norms, what is there regarding safety, COVID protocol, maintaining distance, wearing a mask have been advised by the Health Department.
All right. All right. Thank you so much. I'd like to thank all my colleagues and Dr. Sanjeev Bagai for addressing the queries of our viewers and for telling us that right now is not the time to panic. Precaution can be your biggest, takeaway at this point of time. Thank you so much for joining us on this broadcast. Taking a short break.